Wuhan lifts the 76-day lockdown on Wednesday. Can the city prevent a second wave of coronavirus outbreak while easing travel restrictions? And Chinese and American scholars have urged cooperation between their governments. Is the virus the common enemy that can forge a necessary partnership between China and the U.S.? Welcome to The Point, an opinion show coming to you live from Beijing. I'm Li Xin. On Monday, for the first time since the outbreak, the city of Wuhan in central China saw no new deaths. It reported only 2 new confirmed cases in the past 2 weeks. The number of severely ill patients in the hospitals has dropped from more than 9,000 at its peak to 181 on Monday. The good news came 75 days after Wuhan first locked down on January the 23rd. Residents will finally be allowed to leave the city. And yet, will there be a second wave of infections after restrictions are eased? Looking back, what did Wuhan residents' sacrifice mean to the containment of the virus worldwide? I'm joined on the phone by Professor Xie Tao, Dean of the School of International Relations and Diplomacy at the Beijing Foreign Studies University, and from South Carolina in the U.S., Professor Lu Shi, Associate Professor at the Department of Public Health Sciences at Clemson University. Gentlemen, welcome to the show. So I want to talk about the significance of this day. According to some study, the lockdown prevented 80% more infections, prevented more than 700,000 infections across the country. That's according to an international team of researchers on a research published on the respected magazine Science. So Professor Xie, how is Wuhan's lockdown different from travel advisories in other countries, and what has Wuhan's lockdown told you?
Well, my understanding is that social distancing or travel advisories are these rules that were imposed in the United States and Italy, other countries, are largely voluntary, and they are not very strictly enforced by government officials or by social workers. Whereas in our case, in Wuhan, this is a very strictly enforced. And there are a lot of government officials, community volunteers that stay at the entrance to every major building, every residential apartment to make sure that people follow these rules. They wear face masks and others. And so I think Chinese measures have been much more effective, and they have been more extensively applied. That been much more strictly enforced. So in that sense, I think that's really lies at the center of Wuhan's success, that emerged out of this lockdown with very significant an example of success for the rest of the world.
Yeah, help our audience understand, because in China it seems that also the residents of Wuhan, although some people do bridle at the kind of restrictions to their freedom of movement, but it seems that there is a higher level of understanding of cooperation to these kind of measures. From a cultural and sociological perspective, Professor Xie, what could possibly explain that?
Right. Liu Xian, you mentioned this political and cultural difference. In China, I think there's this habit. People have formed this kind of internalized idea that when government says that we should follow orders, this is a national emergency, and people stay at home. Most people do tend to follow these words, whereas in Western countries, because of this belief in individual freedom of movement, we can walk around, walk my dogs, and so people feel like this is a government invasion of their privacy. Now, once you take this as the starting point, that the government is doing something to interfere in my private life, and people would easily get irritated, and they would tend to be much less cooperative compared with their Chinese counterparts. So in that sense, I think from a sociological point of view, the Chinese success lies as much in Chinese government's effective measures as in Chinese culture.
Professor Lu Shi, let's look at this whole experience from a much wider angle. 76 days. 9 million people, although the city of Wuhan normally has about 11 million people, but by that time quite a number of people have traveled outside of the city, so literally 9 million people also were locked down in the city. And actually the entire province of Hubei, where Wuhan is the capital, has a population of something like 56 million people, and basically the entire province was also locked down for an extensive period of time, although that restriction already lifted a couple of weeks earlier than Wuhan. So how do you look at this experience from the perspective of human history, and also how do you understand the science behind the choice of this specific date, 76 days on April the 8th?
Yeah, I think this truly is an unprecedented move. During the 1918 pandemic flu, some of the U.S. cities did that kind of a traffic blockade and kind of trying to limit the traffic, but none of that is even getting close to what Wuhan has been doing for the last 70-something days. And so the kind of level of
yeah, I'm sorry, the signal was not good. Can I?
In modern history.
Yes, go ahead, please.
Yeah.
Professor Liu, please continue.
And I think that the big lesson is that when we go ahead with that level of lockdown, please make sure that other non-pneumonia patients get the care that they need. They are very likely to become the victim of this level of lockdown. So please make sure that they get the medical care they need. The dialysis patients, the cancer patients, the cardiovascular patients, they need urgent care as much. So other measures have to follow up to make sure they stay out of the death risk, just like the pneumonia patients.
What do you think
so
of the rationale?
So that's one big lesson we learned.
Yeah, what do you think of the rationale behind the choice of this specific date? I mean, already for a couple of weeks, actually, we're seeing the number of daily new infection cases literally close to zero, in one digit, single digit. And yet, this April the 8th, this date, 76 days, what do you think of that? What kind of scientific evidence could you find to, that the Chinese government might have referred to in order to make this decision?
Yeah, I think that has something to do with the incubation period of this particular disease, COVID-19. I mean, it could be 14 days. And you have to wait for 1 or 2 entire incubation periods of that particular disease.
All right, it seems that the signal is not very stable. Let me go back to Professor Xie, and this is a very interesting question. We actually had an article published by the People's Daily just a couple of days ago by academician Wang Chen, who is very respected, and he was talking about this difference between the Chinese approach and the Western approach. The Chinese approach is more effective, he said, using the word effective, 感性的, whereas the approach in the European countries, North America, is more sustainable maybe, or more science-based, more rational. What do you think is the signal that he was sending? Is China thinking of a different approach finally? Because after all, you cannot lock down a country just like as easily as you can lock down a city. Is that what's possibly behind the very important message? Professor Xie.
Well, I also came across that article you referred to just now by this very esteemed epidemiologist in China. So his argument is that the West, they have this so-called national immunization approach. That is, and we just simply allow people, those who are elderly, people who are not, so healthy, to die in the face of the epidemic, so that the whole nation as a kind of a national gene pool, and that will improve people's public health. Whereas in the Chinese case, the government cares about each and everyone infected patient, and so we try our best to save each and every life. And so you can see that we put a lot of emphasis on saving lives at the moment. Whereas Western countries, according to his argument, is that they tend to look at the long term. So that's why they call this a more sustainable approach. I am not an expert on medicine, on epidemiology, but I think, maybe there are merits to both approaches. At the moment, however, I have to say the Chinese approach seems to be much more effective, and it also seems to be much more reassuring in terms of sending a message to the Chinese people that the government does care about its own citizens, and the government is trying its best to save people's lives.
And also with the help of masks and a certain level of caution and distancing, people are able to actually get back to a minimum level of economic activities as well. However, there is also this very interesting article which just came out the other day by, about an interview by Dr. David Ho, and I want to go to Professor Lu Shi there. Dr. David Ho, very well known for his study, for his contribution to the global battle against HIV/AIDS, but he suggested on during that interview, that the world should probably enter into a 4 or 6 weeks Wuhan-style lockdown simultaneously. Otherwise, he believes human beings will just see wave after wave of epidemics reoccurring, or the COVID-19 will never go away. Professor Lu Shi, what do you think of his argument? Could he really be serious? I mean, is that also feasible?
I don't think that's feasible in some of the countries, like some of the third world countries, when people are living from hand to mouth, meaning that they really have to work every day to keep themselves and keep their families fed. So if the entire world get into that kind of 4 to 6 weeks Wuhan-style lockdown, you will see a lot more starvation deaths than whatever the COVID-19 infection-related deaths will occur. So, I mean, that's a good, interesting thought experiment, but I don't think that's feasible, especially if you bring it under the context of the third world countries.
Yeah. Well, on the other hand, looking back, there have been, as I said, studies which show how much the lockdown of Wuhan attributed to the to the containment of the virus worldwide. Professor Lu Shi, I want to ask you this really in respect to what the sacrifice of Wuhan people have meant for other people, for people around the world. How would you describe it? Because they did undergone tremendous sacrifice, and there are studies which have really pointed to the possibility of 96% of incidents being reduced had China not taken such aggressive response, and the Wuhan lockdown was part of it.
Yeah, I think the entire world of Wuhan, the entire world of Wuhan, a big thank you, and there has to be substantial thank you with the assistance and infrastructure investment follow up. It's not just a verbal thank you. People in Wuhan sacrifice a lot for the rest of China and maybe the rest of the world. So there's a lot of experience and lessons to be learned from this kind of extended period of lockdown.
I don't have much time left. I'm going to ask the last question to Professor Xie. What do you think is the biggest lessons that, looking back, the people in China will need to think carefully so that they don't commit the same mistakes or have the same failure next time?
Well, across China, academics, analysts, and public health experts have already been discussing what could have been done better, what kind of lessons we should learn from the virus in Wuhan. Like I said, there's no perfect response in a national crisis like this, and so every government has a learning curve. And in my view, the Chinese government has done largely a terrific job. And even though there were perhaps a moments of hesitation, especially, for example, when you decided to lock down the whole city of Wuhan, which has close to 10 million people. This is just like lock down the city of New York or London, right? That's a drastic decision. And so it takes time for political leadership to weigh the pros and cons of such a dramatic step. And so there's already been a lot of lessons. Some people are discussing we should need to have a better coordination system. And in terms of information transparency, how do we send out this information in a very effective way? And if we have a similar crisis in the future, how do we build up even more and in less time, more hospitals and get more medical professionals over to a particular pace? And this goes on and on. But basically, I would say that the Chinese government should have been even better appreciated by many governments around the world for what it has done to the world, and especially the sacrifices like you mentioned of people in Wuhan. They suffered a lot for the sake of the world. Absolutely. But sadly, some people still don't appreciate what they have been gone through.
Yeah, absolutely. It's going to be a very emotional day when the time comes for the people of Wuhan to be able to leave the city and move around the country, even around the world once again. Indeed, a big thanks to the people of Wuhan for their sacrifice, and many thanks to my guest, Xie Tao, Dean of the School of International Relations and Diplomacy at the Beijing Foreign Studies University, and Lu Shi, Associate Professor at the Department of Public Health Sciences at Clemson University. We'll take a short break, and when we come back, Chinese scholars and U.S. foreign policy insiders have urged China and the U.S. to work together to fight coronavirus pandemic. Can the global outbreak be the impetus to forge cooperation or stronger cooperation between the two sides? I'll speak to two experts about this possibility. Stay with us.